Welcome. In this presentation, we are going to be discussing some of the most important characteristics that dietitians have. To give a brief introduction, you will learn about a lot of these skills that we're going to be talking about and more in college and later on in your schooling and education. But we're going to be going over some of the most common ones today. We've talked a lot about different types of jobs where dietitians can work, and all of these skills are important in each of those jobs. Of course, there are certain jobs that require unique and different skills, but most of these skills do overlap from job to job. And these skills take time and practice, so make sure to be patient with yourself as you learn about these skills and practice them. Sometimes it takes starting a dietitian job just to simply develop them. All right, let's dive in. The first characteristic that we're going to be discussing is communication. Communication is more than just speaking, it's listening too. It's speaking clearly and listening actively. Dietitians work with people of different ages, backgrounds, and cultures, so it's important to be a good listener so they can explain their situation and their feelings. When you teach someone about something you know as a registered dietitian, make sure to explain it in basic terms so they understand what you mean. You have all of this knowledge and schooling and education that you have gone through in your career path, but others don't have that same background. So make sure to explain things that you're teaching them in a very basic way so that everyone can understand. Some situations that in which you use communication are talking to clients. So, talking to clients one-on-one about a nutrition plan or setting goals. Maybe your client is distressed about their weight or they're worried about their new diagnosis. It's important to make sure that you're practicing good communication and listening actively to these clients as they're expressing their concerns. It's also important to communicate well with your coworkers and managers so that they know more about your workload and your work-life balance. Everyone is on a team at work, so it's important to communicate often with your coworkers so that everyone kind of knows about each other's workloads during the day. Good communication is also important to practice while teaching nutrition education. Similarly to talking to clients one-on-one, if you're teaching a nutrition education class or maybe to a patient's family in their room, it's good to speak clearly and again use basic terms so that everyone understands what you're talking about, even though you have all of this detailed and complex knowledge. The next one is empathy. Empathy is a form of compassion that you can develop for someone. So it also involves listening actively and acknowledging someone's concerns. It's good practice to repeat back what someone says, just to make sure that that they know that you understand. For example, if your client says, "I was just diagnosed with celiac disease and I'm so scared to go grocery shopping now." And then you might repeat back, "If I understand correctly, you're having a difficult time with your new celiac disease diagnosis and are feeling worried and scared at the grocery store. Is that correct?" So this is just kind of an example of it's good to repeat back so that you know that your client is feeling heard and cared for. Some of the situations that you might use empathy is, again, when a client is going through tough changes. If someone is expressing their concerns, it's important for you to repeat back and just share that you care about them and that you're going to help them with all that you can do to help them make a plan and set goals. You might also use empathy when a patient is expressing difficulty with treatments. So clinical dietitians who are planning nutrition interventions for people, whether it's tube feed or a certain meal plan that they're adhering to. If the patient is expressing concerns or difficulty with the treatments, it's important for you, obviously, to provide the best care for them, but also to listen to their concerns and their needs. Everything is very client and patient and individually driven in the dietetics world, so it's important to make sure that you're also taking into account what the client or individual wants. A manager, a dietitian manager might also express and practice empathy while managing employees. If some employees are maybe concerned or if they disagree about a certain process or system that's in place within your realm of management, it's important to make sure to listen to those employees one-on-one and maybe in groups, just to be able to be employee focused as well. Same thing, if you're trying to reach a goal for your company, it's important to provide the best system to make that happen, but it's also important to make sure that your employees are in a safe work environment as well. The next one we're going to discuss is critical thinking. So, critical thinking is important for many jobs, not just dietitians. It's when you're presented with a difficult situation and you need to find a solution quickly and thoughtfully. So, it's really thinking through challenges and making informed decisions and making sure that you know where your resources are and how to access them. It's finding the best solution or workaround when there's a problem or a change that happens. Some instances in which you might use critical thinking are doing clinical nutrition interventions. So, clinical dietitians use a lot of critical thinking when they have a patient who maybe is on a tube feed and their progress is constantly changing, and you need to quickly adjust and help the patient receive the correct formula and rate and just change it as needed. So, that's just one example, but just as people change, whether it's in a sit down setting where you're talking to a client who's wanting to lose weight and their progress is also always changing, their weight's changing, it's important to practice that critical thinking and making a plan and knowing that it's important to adapt the plan and adjust it as needed depending on the individual's progress. It's also important to practice critical thinking when doing individualized treatments, kind of like just what I explained, whether it's with a client or a patient in a hospital. It's making sure that the client is heard and that you're tailoring their nutrition plan or intervention to their needs. It's also helpful to practice critical thinking when creating efficient food service systems. So, for example, maybe you're a food service management dietitian who needs to shorten the amount of time room service trays are delivered to hospital patients. Maybe it takes a little bit longer than you'd like, and you want to find a solution to make the kitchen more efficient. Whether that's moving around equipment or hiring more employees, it's important to practice critical thinking to be able to find these solutions to make things more efficient in the workplace. A food service management dietitian or clinical dietitian might also analyze menus for allergies or for other conditions or diseases. So, for example, in a hospital setting, they might have menus for people who have trouble swallowing. So they have different specialized diets and consistencies of food to help patients eat and swallow easier. Or they might have another menu specialized for gluten-free patients, or another menu specialized for low sodium patients, or maybe patients on a renal diet. So it's important for dietitians to use critical thinking of walking through the menus and analyzing them, whether it's for allergies or a specialized condition or treatment. The next characteristic is organization. Registered dietitians can have a lot of things on their plate and a lot of things that they're working on at the same time. So, organization is super important in this profession. It might include keeping information, schedules, and plans in order. Time management is included in organization, making sure that you're dedicating enough time to all the things you're involved in, and also knowing where to access credible information. It's important to find a consistent way to track meetings, client schedules, deadlines, etc. And sometimes your job might provide a calendar or a method for you to organize those things. But either way, it should be consistent. So, and that might take a little bit of trial and error, but it's important regardless to stay organized with all of the things that you have on your task list. If you are a community or clinical dietitian and you need to brush up on your kidney or renal nutrition interventions, you should know where to access credible information like research studies, credible websites, maybe some textbooks, or another dietitian you work with. So, just knowing where to access this credible information where you can get solutions is another form of organization. Sometimes when to use organization is organizing private practice client schedules, again, using a calendar and a consistent method to track those. Also tracking client and patient progress, so just being consistent and organized in your patient chart notes so that you know what the patient's progress is if you work in a hospital. Or if you're a dietitian in a management position, management-focused dietitians create employee schedules, they train new employees, they manage conflicts, and more. So it's really important for them to stay organized since they can manage a lot of people at once and they have a lot of things on their plate. Teamwork is the next one we're going to talk about. Teamwork does incorporate communication, just like we talked about earlier. It's about working well and communicating well with others, and all to achieve a shared goal. So, whether it's an in-person huddle or a meeting, or if it's virtual, regardless, it's important to work hard in your position, regardless of your job. And within your work team, you are all working towards the mission of the company or organization. So work with your department or team that's most close to you to achieve the shared goals of the business that you work for. Some situations in which you might use teamwork are employee teams. So employee teams of other dietitians are constantly working together to get their task lists done. And so it's important to communicate your workloads with the team that you're working closely with, just to make sure that the workload is balanced out. If a dietitian only needs to see 3 patients that day and another dietitian needs to see 12, maybe they can communicate to help each other out. So again, this varies from job to job. This is just one example of how to use teamwork with your employee teams. Another way to use teamwork is within those multidisciplinary teams, which include the doctors, nurses, pharmacists, speech therapists, physical therapists, and so just making sure that you are putting in your work regardless of what exactly you do as a dietitian, but just making sure that you're putting in your work and so that these other members of the multidisciplinary team can continue to provide care. Some of them might be waiting for an update on their nutrition progress, so it's important to put in the work and show that you value teamwork in this setting. And then the last example is working with chefs or employees in food service. So if you are a food service management dietitian, it's important to show your team, even if you're not hands-on in the kitchen cooking the food, most food service management dietitians aren't. They might be in an office setting managing their employees. So it's important to just be willing to show maybe your chefs and employees in food service and in that team that you're willing to be hands-on and that you're willing to put in the work, even though you might not be in the kitchen working alongside them. There's a lot of different ways that you can show teamwork. And our next one we are going to talk about is professionalism. So dietitians are health professionals, so they should act professional as well. Especially when working with others in a team, it's important to do your work and contribute to the team's goals, like we mentioned earlier. Professionalism doesn't mean you need to be a robot necessarily, but it means you need to represent your title, position, and the company that you work for. It's important to note to be yourself, let your personality shine through in your job, but make sure that you do the work that you need to do. Some examples of times when you can use professionalism is during rounds or meetings. And rounds are basically little meetings that the multidisciplinary team in a hospital, they'll meet together to discuss each of their patients and their progress and their plans moving forward. So it's important to use professional language when speaking in rounds, just to make sure that when you're talking about another individual and their treatment plan, it's important to use professionalism when discussing those things. It's also important to use professionalism when representing a business or company. You do represent the business that you work for, regardless of what that is. So it's important to help others outside of the business develop a positive view on the business or company by being professional and friendly. It's also important to use professionalism in your dress. It's important to dress for your role and your responsibilities. So making sure that you are showing others that you are a health professional and that you care about what you do and those who you treat by dressing professionally. It's also important to use professionalism by treating others with respect. Even as something as simple as complimenting others with whom you work for, or sending emails or texts within your work teams, it's important to act professionally so that you show others that you're treating them with respect and so that others can reciprocate and show you respect as well. So professionalism is another really important one. This concludes our presentation on important characteristics as a dietitian, and we hope you learned something new and that you're able to start practicing some of these characteristics now from day to day. So we encourage you to do that, and we hope you enjoy this presentation. Thank you.